Good morning or good afternoon, everyone. Thank you for all gathering on this very important observance of World AIDS Day. I'm joined by I'm Darrell Steinberg, by the way, the mayor of Sacramento. I am joined by a number of my fellow public officials who you will hear from in a few moments, as well as the leaders of a number of the lead advocacy organizations who are fighting to ensure that those with HIV know they have it because they get tested. Here's the good news and the bad news, I suppose, that brings us together today. On the one hand, when we look over the course of many decades, thank God that AIDS is no longer a death sentence. When you think about what occurred in such personal and tragic ways for so many of our friends here, the loss of life of people from this terrible disease, and how far we have come now with a daily pill, and early testing and identification, HIV and even AIDS is more of a chronic condition as opposed to a death sentence. That's the good news. The bad news is that there are far too many people who aren't getting tested, and disproportionately people from our communities of color. And so we celebrate all of the great achievement and advances, the life-saving advances. And at the same time, we soberly urge through the public media here, everyone to get tested. If you're sexually active, if you're a member of a at-risk group, that take advantage of these wonderful organizations here, whether it be One Community Health or Sunburst or the LGBT Community Center and others who provide free available testing so that when you get tested and if you test positive, your life can be a long life. That's what we're here to ask for. Because this is life and death. And people don't have to die. People with HIV can live great, long lives. HIV Day here in Sacramento, World AIDS Day. Let Sacramento, as always, with Paul Curtis and Denny and Michael and all the people and Ted and all the people who have been pioneers in this movement, let's continue the great work that they have done to save lives. Thank you very much. I'd like to turn it over to Jake Bradley-Rowe for some comments. Jacob.
Well, good afternoon. My name is Jake Bradley-Rowe, and I'm the Executive Director of Sunburst Projects. We're a local community-based organization that has been working more than 30 years to help fight the HIV epidemic and bring it to an end. We're here today to remember those that we have lost. And we're also here to honor the resilience of those who continue the good fight against HIV and AIDS. There's an estimated 1.2 million people in the United States that are living with HIV, and 160,000 of them who do not know their status but are positive. And that's my story today that I want to tell you about, the importance of testing. The National Ending the Epidemic Strategy on HIV says that if we work hard and come together, by 2030, we can reduce new infections by 90%. But we must test to do that. The CDC recommends that everyone between the ages of 13 and 64 should have at least one HIV test as part of their health regimen. But if you're a part of a high priority audience group, like men who have sex with men or those who have multiple sexual partners, you should establish routine testing as part of your health care. And that's why the agencies here today are offering free confidential services to you. I want to introduce some of those folks. We have Christina Kendricks-Clark from Harm Reduction Services, Joyce Mitchell, Dennis Mangers, Michael Sestak, and Ted Ross from the Capital City AIDS Fund, Richard Hernandez from Catholic HIV/AIDS Ministries, Michelle Monroe from One Community Health, Alexis Sanchez from the Sacramento LGBT Community Center, Clement O'Sullivan from Golden Rule Services, and Paul Curtis from Sunburst Projects. HIV is preventable. If we're going to end this epidemic, we must raise awareness of HIV. We must increase the knowledge of people's HIV status through testing. And we must expand the use of prevention, such as condoms and PrEP, a once-a-day pill that you can take to prevent yourself from becoming HIV positive. If you need an HIV test today and you live in the Sacramento area, visit the County of Sacramento's Public Health Department website for a listing of all the agencies that are represented here today and the services that are offered to you free and confidentially. Together, we will end the spread of HIV. Thank you so much. I want to introduce County Supervisor Phil Serna.
Well, thank you and good afternoon. As was mentioned, I'm Phil Serna. I serve on the Sacramento County Board of Supervisors. And on behalf of the board, I am proud to stand with my friends and fellow elected individuals and the service partners that are so valuable to us here in the Sacramento community, especially with regard to their partnership in the HIV/AIDS health space along with Sacramento County. As many folks know now, especially as the pandemic begins to fade a bit, I think there's been a new public awareness about the import of county governance when it comes to public health and being good stewards of public health. And again, that's why I think it's imperative that a county representative be with this distinguished group of people and advocates and activists to make sure that we understand that because of the advances, as the mayor referenced, in medicine over the past 4 decades when it comes to HIV and AIDS and prolonging life and improving the quality of life, unfortunately, what we've seen too often is complacency. And that is really the fundamental threat that we face today, is complacency when it comes to achieving the goal of eliminating HIV and AIDS across the world, across the globe. And so I'm certainly very proud to wear the county hat today to help make sure that the public understands that 1 in 7 people that have HIV don't know that they actually have it. So again, the import of making sure you're tested is paramount. And so again, just proud to be with this distinguished group here on World AIDS Day 2022. Let's not forget that the other 364 days, we do not let our guard down and we continue to advocate as we do today. So with that, I'd like to introduce Alexis Sanchez with LGBT Center. Thank you.
Thank you, Supervisor. Hi, everyone. My name is Alexis. I'm the Director of Advocacy and Training for the Sacramento LGBT Community Center. I'm really honored to be a part of the Sacramento LGBT Center and to do the work that we do to lower HIV transmissions in the area, specifically focusing efforts on areas of Sacramento that have some of the highest rates of new HIV transmissions. My background is in public health, and in public health, I was often looking to answer the question of why are certain groups disproportionately impacted by HIV or a variety of other ailments. When we looked at HIV specifically, since the start of HIV, LGBTQ plus people have been disproportionately impacted, right? We were one of the first communities that was hit and hit very hard by HIV to the point where we lost, a whole generation of individuals. I'm always stricken by seeing the images of the San Francisco Gay Men's Choir, and you see, a few people who are wearing black to signify that they are the ones who survived, and they're a very small percentage of this particular generation. But when I think about HIV transmissions now, I think about some of the communities that are still disproportionately impacted. Black and African American communities and transgender people and the people who are at the intersection of those communities make up some of the highest rates of new diagnoses, not only in the region, nationwide. And when we start to unpack the reasons why this occurs, we start to look at barriers to access to healthcare, right? Many transgender people and many people of color struggle to find a doctor who is culturally aware and can really understand the challenges that they go through. We find people, transgender people have higher rates of not being able to access housing, higher rates of unemployment, and these key indicators are gonna expose people to more risk and put them at more risk for HIV transmission. So this World AIDS Day, absolutely. I ask for more testing. I encourage people to get tested and know their status. I regularly get tested and know my status, and I share that to break down some stigma. But I also ask that we all work together as community organizations, as policymakers, to start to affect some of those social determinants of health by building more affordable housing, creating job initiatives, and taking away some of these risk factors so that moving forward, we can see lower diagnoses in the next decade. So thank you. With that, I'd like to introduce Mayor Pro Tem Eric Guerra.
Buenas tardes. Good afternoon, everyone. Eric Guerra here, Councilmember for District 6 and Mayor Pro Tem for the City of Sacramento. And I'm standing here very proudly with so many leaders in our community who have been advocating to make sure that we have strong, healthy communities, strong, healthy families, and most importantly, to be aware, to be tested, and to talk about the importance of making sure that not just today on World AIDS Day, but to making sure that we do it every day, and to making sure that our communities, our Black and African American, our Latino, our transgender communities are making sure that we're discussing an issue that's still with us today. Yes, I want to echo the issue that Supervisor Serna mentioned about the unfortunate complacency that is happening because we've made very large strides where it is not a death sentence. But we still have in many of our communities who have lower health outcomes. There is a lack of awareness. And some of those social determinants of health that affected us during the pandemic, that affect us with other issues now today, as obesity and poor air quality, the impacts of our lung development are still impacting us even to this day with the issue of AIDS, and making sure that we are fighting for families to making sure that they have the right housing, that we're building affordable housing, that we're accessing public transportation so that they can get to a doctor, that they can get the testing that they need, that they get the information that they need. Unfortunately, in the medical field, there's only 6% of Latinos who have medical doctorate degrees. We still have a huge gap making sure that we have those issues. And more importantly in this, talking about it in that absence of those medical professionals, we need to have everyone working about access to making sure that people know that they can get tested, they can go to the county website, they can get the information that they need, and that they can protect not only themselves but their families or their future families. Now, ahorita lo voy a decir que for those of you that speak Spanish, hopefully, I wish our friends in Spanish media were here today, but it's live streaming, so I hope they'll catch this. Ahorita, con una pastilla podemos prevenir la muerte por esta situación del AIDS, de la SIDA. Con una pastilla y con la prevención de tomar su examen. Ahorita, como en la pandemia estábamos tomando nuestros exámenes para ver cómo podemos proteger a nuestra familia, aquí también unos podemos ayudarnos. Tenemos que cambiar esta situación que está afectando muchas de nuestras comunidades y derrotar el pensamiento que tenemos aquí sobre el estigma, la impresión que tenemos aquí. Unidos podemos cambiar la salud de nuestra comunidad y también de inculcarle a nuestros jóvenes que participen en la prevención, usando protección cuando están activos en la sexualidad. Pero más que nada, ahorita apoyándonos y derrotando este temor sobre la SIDA, porque podemos combatirlos juntos. We can fight together against this issue. Again, I want to thank everyone here for participating in making sure that we're making it more aware and recognizing that still we have a higher impact in our disadvantaged communities, in our communities who are Latino, transgender, Black and African American. Together we can do it, si se puede. Let me introduce our council member also here who is with us today and representing the area of our LGBT community center and many of our nonprofits, Councilmember Katie Valenzuela.
Good morning. It is an honor to stand here today in the presence of so many that have worked for decades to address this crisis in our community. My name is Katie Valenzuela. I'm the council member for District 4 here in the central city of Sacramento. And I think the message is very clear here today as we notice a lot of us aren't wearing masks up here anymore. And that's because we are coming to a lower transmission rate for COVID-19. And in that, addressing that pandemic, we demonstrated that we know how to bring testing to communities who need it, that we know how to do community education, that we know how to get treatment to those who need it, and that sense of urgency and that sense of possibility that it is possible to get to 0% transmission rate. It is possible that no more deaths will ever occur because someone doesn't know their status and gets ill. This is the task that is before us today. This is the commitment that you are seeing from the county, from the city, from so many of these amazing service providers and advocates behind us here today. If you are watching this today and you do not know your status, go get tested. That is the message today. This is the same message in COVID-19. You want to protect those you love. You want to protect those that you care about. You want to protect yourself. Just go get tested. It is free. It is confidential. We will help you get there. These service providers behind me will do everything they can to make sure you have what you need. But there is no reason that we shouldn't be able to stand here in a year from now and say, wow, look at that transmission rate. It is almost zero, or it is zero. We can do this in Sacramento, just like we were able to work together through the COVID-19 pandemic. We can continue to work together to make sure that HIV and AIDS is a thing of our past, and that we are just remembering and honoring those who went through that tumultuous time as a historical moment and not as one that we are still experiencing here in our community. So thank you so much for joining us here today, and I'm sure anybody here would be welcome to answer any of the questions that the press might have. Thank you.
Good afternoon, everyone. Paul Curtis from Sunburst Projects. Just want to thank everyone for coming here today, for all the leaders in the HIV and AIDS community and our elected officials today to stress the importance of World AIDS Day, remembering those we've lost, honoring those who are still living with the disease, which includes myself as a long-term survivor, and to continue testing every day, not just on World AIDS Day. That's it for the press conference. Everybody here is available for interviews with any of the news crews or any of the reporters here. We thank you very much for coming and thank everybody here. Thank you. And if you're going to have, you're going to do